Welcome to The Stumbling Spirit, contemplations on the path of resilience. Whether you realize it or not, you are resilient. It's your birthright. As you take in your next breath, know this truth. It's not only about your capacity to overcome difficult situations, but it's about your courage to do the necessary work to heal, learn, grow, and move forward. What you gain is invaluable wisdom. And it's through these hard stumbles in life that we often discover a new purpose that aligns with our spirit. My name is Fabio da Silva Fernandez, Reiki Master, Mindfulness Coach, and Mystical Explorer. Join me weekly as the Stumbling Spirit podcast highlights the lives of extraordinary people like you, sharing transformative stories and beneficial practices of resilience to guide you on your wellness journey. Psychedelic therapy involves the use of mind-altering drugs such as psilocybin, DMT, and LSD to help those who suffer from mental health conditions like depression and addiction. Still highly experimental and somewhat controversial, only a few countries have either legalized or decriminalized this therapeutic practice. Last year, Dr. Dave Bradley was awarded a Churchill Fellowship to explore both contemplative and psychedelic-assisted approaches to the existential well-being of patients within palliative care settings. Based in Scotland, Dave is a palliative care doctor who uses mindfulness approaches to support his patients. Dave is here to discuss his research and insights on what it means to be human in the face of loss and uncertainty. It's a pleasure to welcome Dr. Dave Bradley to the show. Hi, Dave.
Hey, Fabio. How are you?
I'm doing well. Welcome to the show.
Thanks so much for having me on.
I should say that I referenced some online resources to bring myself up to speed in terms of what psychedelic therapy is, such as healthline.com and hillnotes.ca and BBC. And also for our listeners, psychedelic therapy is also referred to as psychedelic-assisted psychotherapy. I just wanted to hone in on something very specific that you talk about, and that is existential well-being. What does that mean?
I think existential kind of refers to the fundamentals of human experience. It's how we make sense of ourselves, as the philosophers would say, in a world that is unknowing and uncaring. And I think that's a sort of philosophical kind of approach to it. But really, it's as you said, it's what does it mean to be human? Like, what is it that makes us tick? Like, what gets us going? What's at our core in terms of our values and perhaps our needs? And so existential well-being, I guess, is a term that really refers to what makes our personal existence meaningful, and oneself is competent to kind of approach and face the difficulties in life. A lot of the science around existential issues really focuses on the idea of existential suffering, that being a sort of state of lower morale and characterized by helplessness and hopelessness, loss of meaning, loss of purpose in life. And I think my approach really is to think about it. Okay, well, we want to look at helping those with existential suffering and who are facing those difficulties when it comes to, particularly in my context, a life-threatening illness. But the focus really being more solution-based on moving towards well-being rather than focusing on fixing or eradicating the idea of suffering.
Yeah, I mean, when you talk about existential suffering and you talk about that sense of the loss of purpose, obviously that fits in line with the work that you do in relation to dying and death and palliative care specifically. You've been practicing medicine for more than 20 years. Why did you pursue palliative care?
I think it was out of necessity more than choice at that stage. My background's in general practice, and I was really interested as a GP in people's stories. That idea that you get to to help someone sort of from cradle to grave, as it were, in that sort of traditional sense. And you get to see someone's narrative arc. But I quickly discovered in my training and in my practice that you don't have an awful lot of time. And so you get to hear people's stories, but not necessarily have the resources or the time to be able to help them reframe or tell a kind of different, more helpful story. So I kind of floated around a little bit, found it easier to kind of fix problems related to illness and disease. Ended up being an emergency physician for some time. And then, of course, COVID hit. And within a year and a half, really, of COVID, I kind of found myself in a position of burnout. I really had to question what I was doing and how that was impacting on me, and was looking for a way out of the job that I was doing. I happened to stumble upon a conversation of one of our palliative care doctors in the hospital where I work, so talking to someone else saying they had an opening. Did they know of anybody? And my ears kind of pricked up, and I sort of pursued that and got a job within palliative care. It had been something I'd thought about for some time, but hadn't really known how to access it. And I think having got into it, I wished I'd found it a lot sooner. I think I found a lot more satisfaction in it. I found a lot more sustainability in terms of, again, working with people's stories, not just in that sort of physical sense of things, and almost taking the pressure off of having to fix and cure. It was more a sense of looking then at the idea of healing and healing of personhood. As I sort of began to see it a lot more again, that personhood really is the story someone tells about who they are in the world.
Thank you for sharing that. I know that COVID really hit the healthcare industry really hard globally. I actually still feel that they're feeling the after effects, the aftershocks of what's gone on with COVID. You know, people are really overworked, nurses, doctors, etc. I want to explore that a little bit further with you. So you're working in Emerge during COVID, you're feeling overworked, and there's a catalyst that makes you or drives you to change course. Can you explain that a little bit more to us?
I think this is the idea of where suffering comes in. You know, there's this sort of existential threat, almost an existential crisis, a loss of meaning, a loss of sense of self. Like just things aren't making sense anymore. Things aren't working anymore. There's that sort of dragging feeling of angst or even dread going to work. And I think also, you know, that the idea of, you know, to introduce the term moral injury comes in as well. That sense of like you're wanting to do the job that you're trained for, and you're feeling that you're just not able to do it for a host of different reasons. And in this instance of sort of the pandemic, it was really around the demand outstripping resources. And I think that people's needs had really skyrocketed and sort of mushroomed and over those months, and the sense of support networks and social cohesion that we had was just completely outstripped. So any sense of coping that people might have had was then removed. And so I think they looked to professional bodies or societal systems to try and make up for that. And I think a lot of us as healthcare professionals felt that weight. And so the drive for me was really one of how do I restore a sense of integrity and restore a sense of balance to my life that allows me to live and function in the world without this sense of moral injury or moral residue, and be able to do so in a way that is in alignment with my values, with alignment with my intentions. You know, I think the process of change is really around whether you can, you know, do you change your external environment or do you change your inner landscape? And often it's a combination of both, perhaps, or one leads to the other. But yeah, for me, it was an act of self-care, an act of survival, really, that drove me to look for that change.
Can you elaborate on what you mean by moral injury?
It's a term that kind of came up through the military, I believe, and sort of entered healthcare literature just prior to the pandemic. But it kind of came to fore really during that. And sort of moral injury is when you're witness to something or part of something that goes against your moral compass or your moral values. And so it can be acts of commission. So you're seeing something that really goes against what you feel is right. It can be acts of omission. So you're not able to do something that you know is right, the right thing to do. Or it can be acts of betrayal where you're got a sense that something that you would like to see happen isn't happening because of some failure in the system or in those in terms of leadership, or you're able to affect change.
I'm just reading between the lines, and it sounds like you weren't aligned with something that was going on in the workplace or in what was happening at that time during COVID in the emerge, and that caused you to pivot in a different direction. Is that fair to say?
Yes, I think that's absolutely true in terms of the changes that I felt I needed to make in the short term. And that, interestingly allowed me then to look at sort of more internal changes that perhaps needed to make. I mean, this idea of the difference between our motivation and our intentions. So something recently I was on a course with Joan Halifax at her place in Upaya, the Zen Center in Santa Fe, New Mexico. And it's a concept that I kind of learned there that really our motivations are sort of pre-conscious. We have this sort of sense of what kind of drives us, but it's kind of through our experiences early on and maybe particularly our experiences growing up and in childhood. And then later we sort of have these intentions, and most of us go into healthcare with an intention to kind of make a difference, to improve somebody's life, to heal, to cure. But that's hard. That's hard work. You're dealing with someone's pain and suffering, and you've got to bring a lot of qualities to that. And there's a potential for you to have your own kind of suffering as a result of somebody else's, that sort of vicarious trauma or suffering that you get through repeated exposure to somebody else's pain. So often those intentions that you have, as well-meaning as they are, can often be a little bit hijacked by your motivations. And so your motivations might be, I want to feel safe. I want to feel like I'm making a difference. I want to feel valued in this world, and that might come up with thoughts in terms of like, I just want to go home and not think about my job and different things like that. But as we know, we can carry a lot of stuff home with us. So the idea that our motivations are different from our intentions is interesting, because then it has implications for how we show up and how we kind of attend to those that we're caring for. And I think maybe that's part of our internal moral injury. We've got that sense of, here's what I want to happen, but I'm sort of being sabotaged by this sort of these other desires that are unconscious that are happening. And for me, the work recently has been, how do I align my motivations with my intentions? Like, how do I go back and kind of heal those experiences that perhaps have made me feel less resourceful or less able to be present, because my mind is kind of taken away and distracted and pulled towards my own sort of selfish needs versus being resourced and having the ability to attend to somebody else's needs from a place of capability and resourcefulness. So one of the things that kind of happened in this course for me is that I kind of woke up in the middle of the night one evening with this phrase in my head of like, I no longer need to satisfy the conditions of my wounds. And it was a real sort of sense of looking back in terms of some of the work I've had to do on myself and the healing that I've had to be on, to sort of realize that actually there's some stuff that's happened that has taken care of the conditions of those wounds, like those needs that I had around my motivations to be safe, to be valued, to be liked, to be loved. And I realized then, that those oftentimes those intentions are often the gifts that our motivations have always longed to be. By looking at our intentions, often we have insight into the work that we need to do on ourselves. And if there is that mismatch, as there was for me working in the emergency department, trying to make sense of what I was doing, then actually it was, I mean, there are a whole host of things that needed addressed, not just within me, but on a systemic level. But actually, it also allowed me to think and to work on what are some of my wounds I need to pay attention to that allow me then to show up once that's been done in a much more resourceful way to the benefit of both myself and to others.
And it's continual work to align motivation with intention to get out of our own way in terms of manifesting things that are aligned with our purpose. That's wonderful that you were able to reach that place. What's interesting is that you moved from an environment where you're probably witnessing a lot of people going to the ICU, dying, and in that release of resistance, you moved from a space where there was much death to another space where there is much death, but it's just a different lens that you're looking through it. So, can you speak a little bit more about that?
I love how you say that. It's just a different lens through which you're seeing it. And I think that's exactly right. You know, often we will see in medicine, we'll see death as a failure, or at least a problem to be solved, an issue to be avoided at all costs. And in a lot of circumstances, absolutely. There's a lot that we can do to help someone in a very life-threatening situation, be that through addressing some sort of traumatic accident or treating a overwhelming infection or any of those things. But also, there is a point where all of us will have to die, and we're all going to have to die of something. A lot of the time, medicine, I think, at the moment is prolonging life in terms of the quantity of days that we might have, but not in terms of the quality that we're experiencing that. And that, I think, is an individual choice. Like you get to choose, or you should get to choose, do I want treatment for this or that? But it should be an informed choice also of, you know, is that going to benefit me in terms of my motivations and intentions? And I think that's where I enjoy those kind of conversations, really, of saying, what's important to you? Tell me about, you know, Churchill talks about what is it I need to know that's important about who you are. And that question's a great question because then it allows you to really get into the values of who that person is, what's important to them in terms of the decision making, how they make decisions. And then it's, you know, they can choose when they're ready to say, I don't want any more treatment for whatever condition they might have that is going to prolong my life. And I'm ready to think about how that might be coming to a close. And then there's a whole other host of conversations that I think should happen or could happen in terms of how that plays out for them and in terms of bringing some peace to their certain situation and to the story that they've been living. But to answer your question, yeah, I think, you know, moving from one place of death where, you know, I guess that the pandemic was really quite a an outlier in that, you know, we were seeing things on a mass scale and in relatively otherwise healthy people succumbing to this novel disease. But moving from there to a place of a more sort of expected outcome of death, I think there really is something really around the sort of expectation around that, around how we deal with that shouldness, I suppose, you know, what should be going on here and how we make sense of that. That's the whole thing about our culture and society and their attitudes towards death at the moment. I'm probably talking in a very sort of idealized way, but actually, as we all know, we are in a fairly death phobic society. And the idea of death and dying is still particularly difficult for vast majority of our culture.
And yet it is real. It is real. And we're all going to encounter it, as you say. And for someone who is dying, and this is what you were speaking to, sometimes they can lose their sense of purpose. And when you lose your sense of purpose in a helpless situation, then you might experience depressive episodes. And so what you're talking about is in the work that you're doing is you're trying to return that sense of control, autonomy, purpose for the person who is going through the dying process.
Yeah, palliative care is often defined as, improving the quality of life of those facing life-threatening illnesses through the prevention and alleviation of suffering. And I think we need to understand a little bit better what suffering is. If you look at the literature in terms of people's attempts to define suffering, most would agree that it's two components. One is a negative affective experience, and the second is of a loss of sense of self. And it's that relationship that we have to our own sense of self that's important in understanding our experience of suffering, particularly in the face of death and dying, but also understanding that relationship between our experience of our sense of self in terms of well-being and health. So, for example, the experience of awe and wonder could also be defined as a positive affective experience of a loss of sense of self. And the thing that's important there is not the loss of sense of self. Both suffering and awe involve a process of losing that sense of self. So, what is it that makes the difference between whether we think that that's a negative experience or a positive experience? And it turns out that it's really to do with our relationship to something larger than what we assume is our individual sense of self, and just how we frame who we are and our connection to a deeper belonging or a deeper connection.
Part of cultivating that deeper connection that you are striving to drive is this sense of mindfulness. You're trained to teach mindfulness based interventions. What got you into mindfulness?
Most of us will probably dabbled with apps and different things and sort of think, oh, I'll give this a go. But it wasn't until actually a number of years ago I sought out some therapy. And the therapist that I saw at the time used a couple of different mindfulness techniques with me just to sort of ground and center and in terms of when I was feeling a bit dysregulated. And I absolutely loved the experiences, like more so than any previous attempts to kind of sort of utilize mindfulness through apps and things like that. And as a result of that, I kind of enrolled in my own 8-week mindfulness-based cognitive therapy course and really got tremendous benefit from it. I likened it to that feeling of scuba diving. If you've ever been scuba diving, I remember the first time I went, even just like a couple of meters down at the bottom of the ocean, and you're just looking up, breathing underwater, looking at the waves at the top, completely in awe of how this works. You're just like, how am I breathing here? This is incredible. But also that feeling of just being held in something, that is just so much bigger than you. And for me, that's what mindfulness is. It's that sort of sense of just floating in this expansiveness whilst also being held so tightly and securely within that and being able to breathe. And you can look up at the waves at the surface, and storms can be raging. And as we know, bottom of the ocean can be completely unaffected by that. And for me, that's a sort of access point that I kind of have in terms of my mindfulness practice that allows me not only to change my relationship to my experience, but also to do so through a connection to something that's just much, much larger than my individual self. And so having done that course, I remember asking them on it, how does this work? Like, what's the neuroscience behind all of this? And they were like, no, you just need to experience it. If you want to learn all that stuff, you'll need to train to teach. And so I was like, fine, I'll train to teach then. That kind of took me to the next stage.
What's interesting about your analogy is that the first thing I thought of was breath is fleeting. In our lifetimes, breath is fleeting because we're going to lose our breath at some point, right? So I just thought it was really interesting how you talked about feeling the sense of expansiveness underwater and the awe looking up. And I was totally immersed in what you were talking about. And I thought, oh, I have a tank on me and I'm breathing, but there's only so much air in that tank.
But if you think about it though, in terms of, maybe we're stretching the analogy too much, but most of us will hold our breath underwater, and that's when you first scuba dive, that's your instinct is even though you've got a tank attached to you and you've got a mouthpiece that you can breathe through, your first instinct is to still hold your breath. That's what you're conditioned to do. And how amazing that most of us, in stressful situations will just hold our breath. Our breathing becomes tighter and more constricted, and we have less access to the resources of the body. And so, actually, then when we can train ourselves in mindfulness, there is that sort of retraining of, no, I still have access to the breath here. I still have access to oxygen, however fleeting that might be.
So you talk about how you took the mindfulness-based cognitive therapy for yourself and you saw great improvements in your sense of presence, perhaps lifting any sort of stress, anxiety that you were experiencing at the time. What was the switch for you to apply that into your practice?
So I think the connection for me between mindfulness and my lens through which I view the human experience, and therefore what I'm hoping to help people with in terms of my work, is what's the relationship between self and story. I think one of the things that highlighted this most for me is if you sort of dive into the neuroscience of mindfulness, particularly some of the neuroimaging of what goes on, then there's some really interesting things around how we reference ourselves in the brain. Like, how does the brain understand who we are? 20 years ago or so, they were discovering this thing called the default mode network, this sort of area of the brain that kind of carries this sort of sense of our story of who we are, and that story over time and space. It's really our sort of narrative of self, and perhaps even might be synonymous with our sort of ego sense of who we are. But interestingly, when they looked at this in mindfulness practitioners, they found that during mindfulness, this area was quietened, like it wasn't as active. They realized, firstly, that had some benefit in terms of relapse and depression because we weren't ruminating over our thoughts. That sort of default mode sense of self is where that sort of background chatter of what's going on. It's our kind of, that's why they call it the default mode, the default of our thought patterns, like, oh, that didn't go well. That's not good enough. That's not going to work out for me. Oh, I'm not worthy of this. And really, this is going to go wrong. All these kind of things that we might be experiencing as sort of negativity that we ruminate on. So they realized, obviously meditation then switches that off or turns it down a little bit. And that's one aspect of it. But the other aspect of it is that there's this other part of our brain that during meditation becomes more heightened, more aware. And that's our experiencing self. It's a more task oriented, and it's our sense of self outside of time. It's in the present moment. And it's one that's more present to sensation within the body, that sense of interoception, that sense of experiencing senses, and more realizing that is a part of us that is linked to more well-being, is linked to more sort of the idea of flourishing and improving mental health conditions. And so if you're looking at someone who's having a hard time, this idea of suffering being a loss of sense of self, well, really that is about being that loss of that ego story, that default mode, that sense of who we are in time and space, that death is coming, and everything that I think that I am is actually going to be lost. These networks of relationships that I'm part of are all coming to an end. And of course, that's going to be devastating. Of course, that's going to make you feel sad, depressed, anxious, existentially in a place of uncertainty. But actually, that part, again, as sort of science is showing, and as ancient sort of wisdom traditions have long said, is not really who we are. That sense of who we are is more our experiencing self. And to be able to allow someone to be in that place and to connect with that sense of self is the one that's going to be protective against that negative experience, against that suffering, and the one that's going to, allow someone to transcend that suffering to whatever, place that means for them to be. I'm not gonna say, someone needs to move from suffering to well-being, that we're looking at redemptive stories here, that we're, going to transform someone's experience into the most happy ending that it could possibly be. No, but allowing someone to be with their experience with equanimity, with compassion, with curiosity, possibly a sense of joy and awe and wonder, then that is possible. And that's my hope for how to develop this kind of practice in those who are facing their own mortality.
That's so beautifully said and well articulated. I think humanity, humans, we often attach value and purpose to the things in our lives, the external things in our lives, what we do for a living, the things we have, the people we know, the trips we take, all of those different things. And I would imagine that if someone was faced with death, that all of that would evaporate all at once. And that would be a huge shock to the system. And so, what you're talking about is, from a neuroscience perspective, there's this rewiring of the brain for people who practice mindfulness, but in a very real sense, they discover their true self, or a real sense of presence that is separate from that default mode that you're talking about.
Yeah, I think as a society, we're so focused on the content, we're so focused on the outcomes, and we lose sense of our relationship to the experience itself. It's the quality of our relating that is most important, not the content. I guess I'll tell you a story about how that was really made evident to me on a recent experience. As part of my fellowship was in New York last year, and I was making my way to upstate New York to the New York Zen Center's retreat on contemplative care. And I'd so many questions that I wanted to ask around what is this idea of, using contemplation as a means of care. As it happened, I was kind of going through my own existential issues, and that my marriage had sort of ended last year, and so I was dealing with some of that. And on the way, I decided to just check in with my ex, to kind of, having not been in contact for a few weeks, just to see how things were going. And so we chatted for a bit, and then got onto some parts of the discussion which were more emotional, and it just ended up being really quite sort of upsetting for me in that context. And so I sort of ended the call and really started making some sobbing noises, and as I'm driving along, that were just, I had no idea that I could make those noises, So here I was driving along to this sort of Zen retreat in this real state of distress that I was completely unaware of, thinking to myself, this is so not Zen. You're in a right mess to be going here. As it turns out, that's probably completely Zen, of just being in the experience and exactly where I should have been. But it's just to give context to how I was arriving and showing up at this place. And so arriving there, and I've never been to a Zen retreat before. A lot of the practices were new to me, and the sort of ways of in which they attend to that. So on the first evening, they sort of had this announcement that over the next few days we could spend a few minutes with one of the Zen teachers if we sort of sign up. There's a sheet, and they joke that you get 5 minutes, which is less than a GP appointment. And so, yeah, I'm attending these talks and having all these practices and learning all this stuff, but also just I've got a lot of questions, and I sort of think this is my chance to get one-on-one and to ask these questions. And so I'm rehearsing my script, and imagine a lot of people do this going into the doctor or something, but they rehearsing the script of what I want to say. And I'm sitting outside, and when it's my time to come, and one of the guys is like, "Have you done this before?" And I'm like, "No." And I said, "Right, well, there's a little bit of a sort of ritual to it." So he talks me through that, when the person in front of me comes out, I need to stand up, and we both bow at the door, and then I go in and I bow at the teacher, and then I walk over, and then I kneel down and bow again, and then I sit down and say my name and ask my question or say what it is I want to talk about. And I'm sort of thinking, gosh, that's probably 2.5 minutes of my time already taken up just bowing. And so anyway, I go in and I do all that, and I sit down and I look at the teacher, and I just say, "Hi, my name's Dave." And the first thing that comes out of my mouth is, "Emotion is not far from the surface." My voice is quivering a little bit and all of this. And he's looking at me with this absolute sense of curiosity and compassion and love, and to quote St. John of Kronstadt, eyes brighter than the sun. And he just says to me, "What would it be like not to hold on to that?" And in my head, I go, "Okay." I'm just erupt into this blubbering mess of sobbing, and I'm looking every which way, out the window, up at the ceiling, down to the floor, just trying to compose myself, thinking I have so much I want to ask, and yet here I am in this sort of emotional mess. And he just looks at me continually and just says, "Why are you looking away?" As if to say, I'm here. Like, where else would you look? I'm here. And so I take him at his invitation and look at him and just clock eyes, and for the next few minutes did not blink. We didn't really say that much after that. He asked me, "Who's holding this space for you?" And I said, "Not many, not here." And I can't remember much other dialogue, but within those couple of minutes, I was completely changed just by his gaze. And I got up, still kind of sobbing, tears still rolling down my cheek, but actually in a very, very different quality of experience. And had I had an hour to talk about what was going on, end of my marriage, how was the grief that I was feeling, the loss of identity, all these kind of things, I would not have got to that outcome of just being completely held, completely felt that someone had seen me, had understood me, and was just holding that space for me. I went up to my room, and I kind of had a nap, and I woke up, and it came to me. I was like, oh, absolutely. It's the quality of our experience that is more important than the content. I think it was one of the most important lessons that really solidified. Yeah, I feel seen, I feel held in that sort of gaze of compassion.
Thank you for sharing that story. I'm sorry to hear about your breakup. I think that it's so amazing how, in that moment, he was able to hold that space, as you say, but hold it in a way that was compassionate and in a way in which you felt seen, that he was witnessing what you were going through. So I find that to be really beautiful, and I can understand why it would be transformative, especially with someone that you don't know. Let's talk about your fellowship, because there's a lot in this, right? So there's the contemplative side that we've been talking about, but then there's also the psychedelic therapy side of things as well. I guess how I'd like to approach this conversation first is, what piqued your interest in psychedelic therapy to begin with?
I think it's becoming more mainstream in terms of, the media stories around it. I think people are very much aware of the sort of psychedelic renaissance that's happening, and whether that speaks to society's need for meaning right now, for kind of trying to explore its own sort of existential identity and or perhaps crisis. So I think, like many people over the last couple of years, there's been a sort of I've had a growing awareness of psychedelics as a thing, as a sort of emergence in our society, be that through, Michael Pollan book or things on Netflix or other podcasts. And then I think the thing that sort of two things that piqued my attention with that one is that its use within end of life care. And it's a lot of the early studies that have sparked the resurgence in research were in people with advanced cancer. And so just interested in, okay, what's in this? Like, what are some of the benefits here? Because, a lot of the ways in which we approach those kind of issues of existential distress and suffering or demoralization or anxiety and depression within the context of palliative care settings is difficult to access, I suppose, is under-resourced, is poorly understood. So this offers a kind of way of not only a treatment modality or an intervention that might be helpful, but also sheds a lot of research and a lot of understanding on what's going on and what is it that's kind of driving these experiences for people. So that was one. And then the second thing was just when I was going through my mindfulness training, one of the teachers on the course commented on the overlap between mindfulness and psychedelics in terms of the neuroscience. And I'm someone who likes to kind of identify patterns and connections and things. And I was kind of like, whoa, okay, what's going on there? That's really interesting. And I guess that really sparked the fellowship to look at these two kind of areas around the interplay and overlap between contemplative science and psychedelic assisted therapy.
Are there specific drugs that you're looking at?
So in terms of the research, so I'm not doing any clinical research myself. And interestingly, in the UK, there aren't any current trials in kind of advanced illness, cancer, palliative care settings. There's a huge study about to start in across Europe and funded by the EU, and there's a number of studies concluding, just being written up in Australia and the US, and a number still about to happen. But I think that the one that's studied most within the context of palliative care is psilocybin, so the active compound in magic mushrooms. But there's also been work done with MDMA and previously with LSD, and I think there's some work about to happen looking at that in relation to bone cancer pain rather than necessarily existential issues, but they'll probably be looking at lots of different outcomes with that as well. But I think the main one, yeah, is psilocybin in terms of its connection with existential issues as well as anxiety and depression.
Can you explain to me what chemically happens when someone is taking psilocybin, and how is it similar to someone doing a mindfulness practice and just the scientific benefits of it?
So what we know is it's psilocybin, or most psychedelics will be a serotonergic drug. So it increases the levels of serotonin in the brain. And that specifically has some kind of neurological outcomes in terms of neuroplasticity, which may persist for up to 6 weeks after the dosing session. But also in the moment itself, it has an effect on the default mode network. And so that it actually, again, sort of deactivates or turns this down, so that our kind of cognitive narratives about who we are quietened a bit. And the way that they think that helps, and it increases cognitive flexibility. So it allows you to see things differently. So if you're not constantly viewing life through the lens of your own narratives, then you can somehow see what else might be true, what else is there, what other possibilities exist. But also, it increases that sort of connectedness to everything else kind of around us. You know, Aldous Huxley was a writer and philosopher and experimenter of psychedelics earlier in the 20th century, and he famously wrote his paper, The Doors of Perception, borrowing from the lines of William Blake. But it is this idea that, you know, our everyday consciousness is inhibitory. Our stories are kind of our prediction machines about how the world is. And so we see everything through these lenses. But actually, if we can switch that off for a little bit, then our doors of perception are cleansed, as William Blake's poem says. And we get a lot more information about what is going on, what is out there, and about our experience of the world. And it allows our brain to kind of make sense of things in a different way. For example, the idea of ego dissolution is sort of that idea that my sense of identity is dissolved and I become more sort of at one with everything. That then allows me to kind of have a little bit more flexibility about how I see things. So reducing kind of these ideas of what they call prediction errors, so that if my belief is that I'm alone in the world, normally I might be that sense of, well, that's a very upsetting experience. I feel very lonely. But under the influence of psychedelics, there might be this sense of, yes, I'm alone in the world, but I feel absolutely connected and completely surrounded. And so it's a bit like a supercharged mindfulness experience that I was describing. It's like, yeah, I'm alone, but what else is true, or what is my experience of that rather than my story of it, if that makes sense.
Yeah, it does. I mean, it sounds like it induces a transcendent experience. Perhaps some people might call it a mystical experience, but it's just really around the lowering the sense of identity and feeling more of a sense of connectedness with everything. I know that you are not doing a clinical trial yourself, but you are doing research. And so, what have you found in your research in terms of the application of using psilocybin in palliative care settings?
Again, I think the idea of what I'm exploring is, what is the context that this tells us about the care that we're able to deliver. And there's two aspects of that. One is, you know, how would we deliver psychedelic assisted therapy? And there's a lot of questions that remain unanswered about that, around, you know, the safety profile of it, the resources required to deliver it, the idea of when is the right time, what's the optimal dosage, both in terms of the drug and in terms of frequency of sessions. Is it the drug, the therapy, the therapist, expectation bias, or placebo that's having an effect? You know, there's a lot of kind of unknowns that, you know, the numbers and the data just aren't sufficient enough to completely give us a sort of clear sense of how to do this. And that's not me saying that, that is coming from some of the researchers themselves. There is a huge movement towards making these medicines available, you know, unlimited access to these in society. And there's lots of questions around appropriation of cultural practices, where these have come from. There's questions around access and equality and diversity around this. And, you know, so I think there's more questions than answers at the moment. I think the research is, though, is pointing to something hugely exciting in terms of what is going to be potentially available to people in terms of the treatment of some of their mental health conditions associated with, in my context, you know, palliative care. But also, I think, you know, it's one of the things I went into this asking was, you know, what does it tell us about what it means to be human, about our sense of connection or spirituality, or the sense of the mystical? What does it tell us about our relationship between self and story, those ideas of who we think we are versus the experience of who we actually are? And I think this is where the overlap then with the contemplative exists. So for me, there's sort of two big streams coming out. One is it's the quality of our relationship to our experience that's more important than the content. And so, how do we then change the nature of our experience? How do we approach it with these qualities of more sort of beginner's mind or curiosity or acceptance or non-judgment? You know, a lot of these attitudes that we might associate with mindfulness practice, self-compassion, things like that. And the second thing is that our experience depends a lot on our connectedness to something larger than ourselves. And this idea that this sort of oneness with everythingness is also important, that sort of sense of the mystical, the sense of the spiritual, the meaning that we place in our experience over and above just the experience of it. And I think then if that is helpful in the sense of how then do I show up for people in terms of being able to help them in those conversations about finding ways in which they can be in relationship to their experience more rather than the content. And then how do I help them feel a greater sense of connectedness to whatever it is that they feel that is important to them? And for some, that might be nature, it might be family, it might be to a philosophy or religion, it might be to a sense of music, art, or it could be through psychedelics. So there sort of offers a menu of choices around that.
I think it's important to reflect on the considerations. You mentioned appropriation. I was reflecting on this even actually before this interview, in that, a lot of the natural plant-based medicines that are used for sacred spiritual purposes in indigenous cultures are being used by people outside of that context. And sometimes it's not being facilitated by shaman. And a lot of people are just chasing the trip. And so, how do you navigate that?
I think that's a hugely important issue. And it's one that still sits uncomfortably with me. I am not a shaman. I am not part of an indigenous community. And here I am potentially advocating the use of these medicines, these plants that for many are considered sacred beings themselves. And, am I feeding into a larger consumeristic, capitalistic narrative around these, and I think we need to be really careful around that. I think if you look at the history, let's take psilocybin, for example, Maria Sabina was the queen of the mushrooms in Mexico. And, the anthropologists came to study her use of the ceremonial use of the mushrooms and promised her not to, that they wouldn't divulge her identity and that they were merely, again, looking at it from a anthropological point of view. And yet, they didn't keep their word. And, that area became a sort of tourist spot for people coming to experience mushrooms. And ultimately, Maria Sabina was ostracized from her community and because of the impact that it had on their traditional ways of being. And I don't know how we can ethically navigate that, but what I think it also speaks to is that sort of indigenous practice that these medicines were never intended to be used outside of their original context of being connected to something larger. They were part of an ecosystem. They were part of an ecological understanding that humans are part of nature, are nature, have a responsibility as part of nature to sustain and be wise around the use of our resources. And so I think there are some questions around the industrial manufacturing of these medicines and large scale use to just be rolled out. And not only that, I think, in terms of, is it just going to be a case of, people have access to this drug and it's just like, here you go, take this, it'll make you better. But there's no consideration given to the larger context of their ecology, not only in terms of human ecology of the relationships or the practices, perhaps, or rituals around that, but to the ecology at large around our planet and around, how this sort of what this tells us about our role as humans in a larger context.
Yeah, it sounds like a really complex issue. I mean, of course, the first thing that comes to my mind is DMT, which is the thing that everyone is talking about. Ayahuasca, having these ayahuasca experiences, sometimes outside of the context of where these practices emerged in South America, but they're bringing it to North America and other places, but without that sort of cultural context and all of that stuff. In your research, have you thought in your reflection around maybe involving shamans into the practice of giving these sacred medicines to those people that might need it as they're approaching death?
Yeah, I think one of the questions that has come up for me throughout this is what are our rituals? What are the containers that are holding this space? And who are the witnesses to that? So, in the same way as that moment with the Zen monk, for me, there was a container of that space, of those 5 minutes, and there was his witnessing of my experience that allowed a transformation to occur. Then I think we need to ask what are those sort of similar containers, and who are those witnesses that are going to allow transformation, and doing so in a way that is connected, as I say, to the sort of a much more kind of wise sense of ethical responsibility. I'm not sure I have the answer to that. I think, we live in terms of our Western culture in a very incohesive social fabric with a very sort of individualized society. And those rituals and practices that maybe humans have evolved over the millennia to kind of hold these spaces of suffering have steadily been eroded, I think, in our cultural experience. And so, one of the things I would be interested in looking at in the future is how do we kind of reinvent those traditions, but doing so in a way that doesn't necessarily involve cultural appropriation of other people's practices, which I think is really important, fundamentally important. I think we need to learn the lessons of the past. Yeah, it's an interesting emerging question that I think we need to increasingly put ourselves in, and perhaps not be so hasty to try and answer it either, just for the sake of, rolling this out, or, because somebody wants to make a quick buck.
At what stage are you in your research?
So the fellowship itself, it's been really lucky enough that it's allowed me kind of 6 weeks of overseas travel, and I split that up into kind of 2 weeks. And really, it was a case of just meeting with various practitioners or organizations or individuals in the fields of both contemplative practice and psychedelic medicine, and kind of trying to put together some sort of narrative of how this works, or what we insights into how this can be helpful for those experiencing sort of end of life settings. So I just completed the second leg of that journey a couple of weeks ago. I'm sitting with a mountain of notes to try and assimilate some sort of narrative that's going to be meaningful. One of the things I think, this is the theme itself, is like it's not necessarily the content that's important, it's the act of experiencing. And for me, that's been hugely helpful. And, so, in one sense, I see myself as the vehicle of the learning. I was really aware that I want to experience as much as I can in terms of the content. But yeah, at the end of the day, I do need to have some sort of written outcome of that is going to be helpful to other people. So that's the kind of stage I'm at. And then it's going to be looking at ways in which we can sort of make that accessible, and how we could implement some of the findings to improve the experience of others in facing their own sort of existential suffering and distress.
What can you share about the legalization or decriminalization of psychedelic therapy globally?
A lot of countries are going to be in different sort of stages of this. So obviously, even within the United States, different states are at different stages. For example, Oregon are you're able to access psychedelics through licensed practitioners and facilitators. California, you can buy psilocybin in certain parts of the state just over the counter. And other states will have no access to it in terms of a legal sense. And so there's yourselves in Canada will again have different legislation around that. And for us in the UK, it's still illegal to access it with certain exceptions around clinical trials and very controlled settings. Although I think that will change. Australia have made it available in terms of treatment-resistant depression and PTSD. Again, that's through very specific kind of medical settings. And I think Switzerland have a sort of different approach to that again. So, different places will have different approaches to it. And, there's two ways of thinking about it. One is to decriminalize it so that anybody can access it and not be penalized. And then the other way is sort of right to access route, which is that there's more sort of stringent controls around who gets access to it and how that's done. And I suppose that's the kind of debate at the moment.
You're also part of a group that's associated with the University of Edinburgh. You are actually on the steering committee of this group, and it's called MAIN, which stands for Mental Health and Wellbeing in Advanced Illness Network. It's a group that's made up of academics, clinicians, and healthcare providers, and it is concerned around the mental well-being of people approaching end of life. Can you talk about this organization and its importance?
This is a group that's really been set up within the last 6 to 9 months. It's supported by the University of Edinburgh and Marie Curie, which is one of our kind of hospice providers within the UK. And the idea of it is being really a knowledge exchange and research network. And it's really sort of asking what are the important questions that we need to be asking and looking into in terms of what's going to make a difference in someone's experience of mental health and well-being in advanced illness. What are the research priorities? And that's really coming from primarily wanting to know what someone's lived experience is, as well as what organizations feel are important, as well as what legislators and policymakers feel are important. So it's really trying to have that sort of open conversation amongst all of those groups to say, what are the questions we need to be asking that are going to help us provide better care. And so we run kind of, I think, is it probably every 6 weeks, we run an open webinar, various topics, speakers that just explore some particular issues. We've got Dr. Gary Roden coming on, who's he's based in Toronto, the Global Institute of Psychosocial Palliative and End-of-Life Care. So he's doing a session for us in a week on Monday, actually, which I'm chairing. So yeah, so we're really trying to open up the discussion around mental health and well-being in advanced illness, really because the recognition that perhaps it's less recognized as a priority for a lot of people and perhaps less well done in its complexity. Like anything in medicine, we might prioritize the physical symptoms over and above the more sort of psychosocial and spiritual aspects of care. And so it's really trying to redress that balance.
One of the questions you're aiming to answer is, what does it mean to be human in the face of loss and uncertainty? So let me ask you, what does it mean?
Joan Halifax has this wonderful phrase, which I absolutely love, and she says, an unbroken, intimate relationship with existence itself. And I think my understanding of what it means to be human is how do we maintain that unbroken, intimate relationship with existence itself. And it's through that sort of sense of the human experience, the experience of experiencing. It's exploring meaning in life, not necessarily the meaning of life. And we get so caught up in, as we've talked about in terms of the outcomes, in terms of this is who I am, this is what's important for me, and I'm going to sort of fixate on that. When actually, we need to train ourselves again in the art of experiencing, in that sense of what are the qualities that I can bring to how I show up in the world, to how I perceive the world, to make sure that I'm kind of not being closed off to that vast possibility of existence itself. The Indian writer Jiddu Krishnamurti talks about the ability to observe without evaluating is the highest form of intelligence. Just being able to be in our experience without necessarily saying that it's right or wrong, that it's good or bad, that I want this and I don't want that, because we miss so much about what else is there, about what else can be true. And so, the tendency in loss and uncertainty is to close ourselves off, is to defend ourselves, is to, reduce our experience down to an ego that is going to sort of fight to stay alive or to defend itself, when actually there is a whole other sense of connectedness and vastness and possibility that's out there. And so, yeah, what it means to be human is to explore the possibilities of that rather than to close ourselves off from what we think might be this outcome that we fear. And really, it's our perception that dictates the outcome. And so if we can have those doors of perception can be cleansed, if we can open ourselves up to the infinitude of things with more compassion, then I think we'll find that our experience of loss and uncertainty will change.
What does resilience mean to you?
So I think, thinking of this sense of self, the integrity of the whole, intactness, I think resilience really is kind of the ability to preserve or restore that sense of self, but not necessarily, as I've just said, in that sense of like rigidness of who that sense of self is. It's being able to be open to different contexts, to really negotiating what the meaning of that sense of self is, to be open to change and to be open to, the impermanence of that self for something else, And so developing those qualities really allows us to maintain that sense of self, that sense of resilience in the face of adversity. I've recently done some training on compassion, and one of the things that was said, compassion isn't really something that can be taught, but it's something that you can cultivate the conditions for. And I think it's probably the same for resilience. It's like you can't just be like, here's how to be resilient. I'm going to teach you to be resilient. It's more teaching you that sense of how to create the conditions that will allow resilience to occur. And I think some of that is kind of increasing awareness of our experience, increasing those sort of pro-social qualities of compassion and curiosity, discernment, kind of attunement to the world and to others, that just allow that kind of sense of restoration to occur when things go awry.
You're a mindfulness practitioner. I know that mindfulness is very much a part of your practice, but what are your other practices of resilience?
I was lucky enough to meet Dacher Keltner recently in Berkeley. He's a professor of psychology and he studies awe. And one of his experiences, he lost his brother a number of years ago to bowel cancer, and found that in his grief, seeking awe was one of his most helpful practices. And just understanding that sense of awe has been really helpful for me. And so in terms of resilience, awe-seeking might be one of those. So, like whether it is watching a sunset or being in nature or just being curious about how things are, or taking a walk in the woods and just noticing what nature is doing, or watching a David Attenborough documentary about the absolute craziness of our world and what's going on and some of the remarkable wonders that nature is capable of. I think these are the things that help. I definitely I have a journaling practice, which is really helpful, and also, I'm not one for chit chat or small talk, but I really love deep conversation, and so trying to get that with friends as well. So that idea of journaling and conversation with friends is really around, attending to thoughts and kind of co-creating meaning, I think, is that other sense of what supports my resilience. But as you say, also mindfulness. We can't think our way out of problems. We can only experience our way out of things. And so mindfulness is a way of doing that. It's being in the experience moment to moment.
You mentioned co-creating meaning and finding presence. What other benefits do you find from the awe-seeking, the journaling, and the mindfulness?
I mean, you mentioned presence, and that feels like a very important word for me, that sort of sense of embodied presence. Something we haven't touched on is this idea of, I sort of alluded to what's the relationship between self and story, and the idea that our stories, it's not that the content is not important. Yes, the quality of our relating is really paramount, but actually our stories serve purpose, and they really put structure. But the trick is to how do we be as flexible as we can and open as we can to the possibilities of what those stories are. For me and the work that I'm doing, there's a pattern that keeps appearing in all sorts of different disciplines that really tells me a little bit about what are the stories that are important to us, the stories that we kind of need to satisfy as humans. And they are, I think, being, belonging, and becoming. And so this sense of embodied presence is that sense of being, that sense of belonging is that sort of connectedness to self, others, and the world. And then the becoming is what is the value or meaning that I'm creating through my experience with others. And it sort of alludes to that sort of thing of the container, the witness, and then the transformation. It's the becoming kind of just becomes. It sort of flows out of the other two. If we can have that awareness of our embodied presence, if we can have that belonging and connectedness, then the becoming will flow. And it harks back to some of the mechanisms of mindfulness, that sort of self-awareness, self-regulation, and self-transcendence that really come through training our attention. So I think all of these practices, are ways in which I attempt to be in my story of being, how I attempt to be in my story of belonging, that then allow me to be in my story of becoming.
How can people reach you if they want to contact you?
I have an Instagram and an email that are kind of linked. So my Instagram handle is at the Bothy Life. So Bothy is Bothy at the Bothy Life. And my email is thebothylife@gmail.com. Just to give a bit of context, the Bothy is a Scottish mountain hut, which is used as a sort of refuge or shelter for people who are traversing the mountains or out in the wild. And it's always been a nice little metaphor for me of just that sort of healing space or retreat space that I would like to be able to offer people in their wild journey through this life.
No doubt.
Mm.
Thank you so much, Dave. It's such a pleasure to have you on the show. Thank you for sharing your insights on your research about mindfulness and psychedelic therapy and its applications in palliative care. I'm really grateful for you to be here and share your story. Thank you.
Thanks so much, Fabio. It was a pleasure to talk to you.
Thank you for listening to The Stumbling Spirit, Contemplations on the Path of Resilience. This is Fabio da Silva Fernandez. Join me again next week for another episode of transformative stories and beneficial practices to guide you on your wellness journey. If you wish, you can follow and DM me on Instagram at The Stumbling Spirit. Until next time, take a deep breath and another step forward on your path of resilience.